Check this every time you feel chest tightness. 5 heart attack signs. That weird tightness in your chest right now? The one you're probably ignoring because you think it's just stress or maybe you slept wrong. What if I told you that dismissing chest tightness is one of the deadliest mistakes people make every single day? Here's what nobody talks about. Every 36 seconds, someone in America dies from cardiovascular disease. That's 655,000 people every year. And here's the part that'll shock you. Nearly half of all heart attacks happen to people who had warning signs days or even weeks before, but they ignored them. That chest tightness you feel after climbing stairs? That pressure when you're stressed at work? That strange sensation you get when you're lying in bed at night? Your heart might be screaming for help, and you're not listening. Today I'm going to show you the 5 critical signs hidden in chest tightness that could save your life. But more importantly, I'll teach you exactly what to check every single time you feel it. Because the difference between recognizing these signs and ignoring them isn't just about your health. It's about whether you'll be here for your family next year. Stay with me until the end, because sign number 5 is something 90% of people completely miss, and it's often the most dangerous one. Here's the truth nobody wants to face. Not every chest tightness means you're having a heart attack. Most of the time, it's probably indigestion, stress, or maybe you pulled something lifting groceries. Your chest has muscles, bones, and organs that can all cause discomfort. But here's the deadly part. Ignoring chest tightness is still one of the riskiest gambles you can take. Heart attacks often start mild, so mild that people brush them off for hours or even days. Here's what's terrifying. Nearly 200,000 Americans have silent heart attacks every year. These are real heart attacks that cause permanent heart damage, but the symptoms are so mild that people dismiss them completely. They think it's heartburn, stress, or maybe they pulled something. The scary part? You could be having a heart attack right now and not even know it. Your heart muscle could be dying while you're sitting there thinking it's just indigestion from lunch. So, how do you tell the difference? That's where the 5 checks come in. Check number 1. Does the pain spread? This is huge, and it's the first thing doctors look for. Heart pain rarely stays in one spot. It travels. Real heart-related chest tightness often starts in your chest, but then radiates outward. It moves to your left arm. That's the classic one everyone knows. But it can also spread to your right arm, your back, your neck, your jaw, even your stomach area. This happens because of shared nerve pathways. Your heart and these other areas are connected through the same nervous system, so when your heart is in trouble, the pain signals get mixed up and show up in places you wouldn't expect. If your chest tightness starts spreading to other areas, especially your arms or jaw, that's a major red flag. Don't ignore it. But how long should chest pain last before you really need to worry? Here's the rule that could save your life. If chest tightness lasts longer than 5 minutes, or if it keeps coming back repeatedly, that's a strong warning sign. Don't wait it out. Don't try to tough it out. Get checked immediately. Most muscle strains or indigestion resolve quickly, usually within a few minutes. Heart problems? They persist. They linger. They come back when you think they're gone. Now, lasting pain is serious, but so is what happens if you can't breathe. Check number 2. Are you short of breath? But before we continue, make sure to like and subscribe. These are the kinds of tips everyone should know. This one catches people off guard because we think shortness of breath only happens during exercise. But when your heart isn't pumping enough blood, you can feel breathless even while sitting still. It feels like you just can't catch your breath, like you've been running even though you haven't moved. Your body isn't getting enough oxygen-rich blood, and your lungs are working overtime trying to compensate. If you're experiencing chest tightness and suddenly feel like you can't breathe normally, especially while resting, that's concerning. Really concerning. Check number 3. Cold sweats and dizziness. Breaking into a sweat for no reason is one of the most common heart attack warning signs that people dismiss. This isn't the normal sweat you get from being hot or exercising. This is cold, clammy sweat that appears out of nowhere. You might also feel dizzy, faint, or lightheaded. This happens because your heart isn't circulating blood effectively. Your brain isn't getting enough oxygen, so it sends these warning signals. If you're sitting in an air-conditioned room and suddenly break into a cold sweat while feeling chest tightness, pay attention. Your body is trying to tell you something important. But wait, Aren't heart attacks only for older people? Can young people have them too? Yes, and this misconception is deadly. Young people can and do have heart attacks. Stress, smoking, family history, undiagnosed high blood pressure, or genetic conditions can trigger heart attacks in people in their 20s, 30s, and 40s. Many young people ignore symptoms thinking, "I'm too young for this to be serious." That delay in seeking help can be fatal. Heart attacks don't check your ID before striking. And when nausea joins the picture, the risk skyrockets. Check number 4. Nausea or stomach upset. This one is tricky because it's so easy to mistake for the flu, food poisoning, or just an upset stomach. But nausea combined with chest tightness is a dangerous combination. Your heart and your digestive system share nerve pathways, so when your heart is in distress, you might feel sick to your stomach. You might feel like you need to throw up, or you might actually vomit. This is especially common in women and older adults. While men typically experience the classic chest pain, women are more likely to have nausea, back pain, or jaw pain as their primary symptoms. Check number 5. Chest pain that doesn't go away. Here's the final check that ties everything together. Heart-related chest pain doesn't just disappear quickly. It persists. It might ease up slightly, but it comes back. It might change intensity, but it doesn't completely resolve. If you're experiencing chest tightness that lasts more than a few minutes, or keeps coming back throughout the day, and especially if it's combined with any of the other signs we just covered, shortness of breath, sweating, nausea, pain that spreads, you need to take action. Here's the rule. If 2 or more of these signs show up together, call emergency services immediately. Don't wait to see if it gets better. Don't try to drive yourself to the hospital. Call for help. And here's the most important question of all. What should you actually do first if chest pain suddenly strikes? What should I do first if I feel sudden chest pain? Stop what you're doing immediately. I don't care if you're in the middle of an important meeting, driving to work, or cooking dinner. Stop. Call emergency services, and I mean call 911, not your doctor's office, not your spouse to pick you up, not an Uber to take you to the hospital. Professional emergency responders have the training and equipment to help you if things get worse during transport. Don't try to push through it or convince yourself it'll pass. Don't worry about being embarrassed if it turns out to be nothing. Emergency rooms see false alarms every day, and they'd rather you be safe than sorry. If you have aspirin available and you're not allergic to it, chew 1 regular strength aspirin while waiting for help. Chewing gets it into your bloodstream faster than swallowing. Aspirin helps prevent blood clots from getting bigger, which could save your heart muscle. The faster you act, the higher your chance of survival. There's a saying in emergency medicine, time is heart muscle. Every minute that passes during a heart attack, more of your heart muscle dies. The treatments that can save your life work best when given quickly. Here's what you need to remember. Chest tightness can be harmless. Acid reflux, muscle strain, stress. But it can also be your first warning of a heart attack. That's why you should always run these 5 checks. Knowing what to look for gives you control. You're not helpless when symptoms appear. You have the knowledge to recognize warning signs and take action. If you remember one thing from this video, it's this: never ignore chest tightness. Do the 5 checks. Does it spread? Are you short of breath? Do you have cold sweats or dizziness? Do you feel nauseous? And does the pain persist? If 2 or more show up together, get help fast. It could literally save your life.